So, hi, my name is Chad Storley. I'm the manager for Cleveland Clinic Hospice Social Work, Spiritual Care, and Bereavement Services. Today, what we're going to be talking about is communicating at the end of life. One of the things we first want to cover maybe is just some basic concepts. The definitions: exchanging information that shares meaning, involves sending and receiving information, and communication can be verbal and or nonverbal. Verbal communication: words, sounds. Those who cannot speak may continue to understand what is spoken to them. And we should also remember never to assume that one cannot communicate using words or understand what another is saying. Nonverbal communication. These are ways of communicating with each other without using words. Silence and communication. So this is about being present, and this is a skill sometimes that must be practiced. Some things to consider would be environmental factors. We want to encourage effective communication by doing a number of things. We can position ourselves at eye level. We want to eliminate distractions, maintain privacy, allow adequate time for the person to communicate. Don't rush them, and call persons by the names that they prefer. Part of communication, of course, is listening. So listening is receiving, paying attention to, and making meaning about what another person is communicating. Focus on the other person. Be aware of cultural issues. Try to use nonverbal communication effectively. Ask for clarification when needed, and be patient. The ways that we speak are important as well. So the skill of speaking. Slowly and clearly, simple sentences. Avoid slang words. Be aware of your nonverbal language, and don't talk too loudly or softly. Sometimes we may use written materials. We might use large print with dark letters, simple drawings and pictures, simple words, short sentences, and we may have to review the material on a regular basis. We also, again, want to be aware of any cultural differences there might be. Styles of communication vary with different cultures. Identify preferences on how people like to communicate. And words may have different meanings, and try to allow time for questions. There are also gender differences. Men and women tend to communicate differently when sharing information and feelings. Gender differences may exist amongst various cultures as well. Age is something else that we want to consider. Consider developmental age. Use age-appropriate terminology. Remember that elders expect to have respect. And find out how a person prefers to be addressed. Is it by Mr. or Mrs. or by first name? And be aware of any sensory losses, such as challenging eyesight or challenging hearing. It helps to identify your personal style. How do you express yourself? And try not to label those who have a different communication style than yours. Give honest but helpful feedback to other team members. There are some difficulties communicating with dying patients. Things might be cultural and societal issues. It might be uneasy talking about death. There might be no experience being with the dying. We want to consider patients' and families' feelings. And remember concerns of the caregiver. They may have fear, showing emotions or making mistakes, feeling uncomfortable about being around others who are sad, upset, or angry. Common feelings that affect communication. Patients' and families' feelings are affected by fear, anger, guilt, sadness, confusion, hopelessness, helplessness, and love and joy. There are some necessary communication skills. One, we want to take the lead from families about what they want to share with you. We want to ask for permission to have those conversations. And remember, we don't have to have all the answers. We can encourage reminiscing. The important messages that we want to communicate to people are, I will listen to you. I will be honest and truthful with you. I will respect your values and goals. I accept at times that you will be sad, frightened, or angry. When having conversations with others, we want to take in a few considerations. Timing, the physical comfort or boundaries in the situation. We want to take into consideration asking questions, You may have limited energy, so use open-ended questions and respect privacy. Try to provide hope without making false assurances. Part of communication is providing education and support. Help people understand the importance of sharing with each other. We can do that by modeling effective communication skills, using written materials, and explaining nearing-death awareness. Sometimes there's conflict. Issues may surface and result in family conflict. There are many sides to every situation. Do your best not to take sides. Remember, anger may be misdirected toward the patient, toward the caregiver, and grief also may be expressed as anger. One of the things we want to try to do is manage our own responses. Here are a couple of tips. Take an emotional step away from the situation. Think about your emotions. Talk with other team members about how you are feeling. And try to always use I statements. When we're communicating with someone who's angry or depressed, recognize frustrating situations that they might be in. How would you feel? Try to put ourselves in their shoes. Treat others with respect and use active listening skills. Answer questions clearly and try not to keep others waiting. Stay calm. Do not argue or touch the person if they're angry or depressed. And protect yourself from violent behaviors. Report the person's behavior to your manager or another team member. Remember, 93% of communication is nonverbal and 7% of communication is verbal. Learn to be comfortable with silence, as is a skill and a way of being present.